Triage is a French word trier, which means sort. It just means that you're sorting patients so that the ones that have the most medical urgency are being seen first. It's something that's been used in battlefields for probably hundreds of years, I think earlier than World War I. And basically the idea is that you assess and prioritize patients based on their medical urgency so that you just maximize your resource utilization and just try and get everyone treated as efficiently as possible. So there's a lot of different systems of triage in use, and there's a lot of academic writing and research on which ones have the best outcomes. A lot of the veterinary hospitals, emergency hospitals, will use some variation of one of these. Often it's the Manchester triage system, and there are veterinary triage lists that are in development, and they're doing research on what the best way to go about triaging is. I'm just going to kind of go over a little bit of the START system, which is the simple triage rapid assessment, which is often used in disaster situations. And it's something that you would learn about if you take our large animal rescue course. You would basically go through and kind of tag each patient so that you can identify where they are on the priority list. Once everyone is kind of identified and tagged, then you would go through and treat. So with a livestock situation, the black tag is either deceased or about to be deceased, like very mortally wounded, something like if you're picturing a trailer accident, something like an open fracture where you had exposed bone or something, we would call black. And fortunately with livestock, we are able to euthanize them instead of letting them die of it. We've got red, which is injuries that are treatable but immediately life-threatening, such as active bleeding, cardiovascular compromise, shock. Yellow would be something delayed, like a fracture, but that was stable and not open, or something where the patient has got sort of stable vitals and they can wait a little longer to be seen. The green would be minor injuries, cuts and abrasions that you can either treat the next day or treat at the end of the day. And then we've also got this category blue, which you might use if you had a quarantine situation. I was thinking of like an oil spill where you've got animals that you need to clean and kind of decontaminate before moving to a new area. So that's one system of triage. I just put this up because, if you're at your home farm, when might be some situations that you might need to triage. No one in this situation needed any first aid, fortunately, but this is a shelter that was not properly anchored into the ground. And that's what happened. It went into the fence. None of the horses were in the shelter, but we had some loose animals in this situation. So anytime you've got more than one injured animal, you're going to be doing some level of triage in your mind and trying to prioritize who needs to be treated first. So hopefully no one will ever experience any of these scenarios, but some of the things I thought of were a trailering accident, a barn fire, natural disasters like hurricane, something like that, flooding, disease outbreak. You might need to be quarantining different areas of your barn if you had an illness or something that was sweeping through. Broken fence. You've got a bunch of loose horses. You have to round them up and see who's done what to their legs and everything. And then predators, which we don't have a lot of in Ontario, but I have seen one horse, a weanling, that was badly mauled by a coyote in this province. You wouldn't think they would go after something that big, but apparently they do. So here's a broken fence. I also took this photo. There was no first aid needed, but in a hypothetical situation, let's say you have some horses, you've got 3 horses, say, and you come home and find this, and you see 2 of them off grazing in the corner of the property, and then you don't know where the 3rd one is. What are you going to do first? If there's an immediate safety threat, like if there's a giant tree that fell on the fence and took it out, and it's a hurricane or something, you need to make sure there's no immediate threats to your safety before you start responding to the horses. Even just things like ice, like in this scene, it's winter. Make sure you don't walk over to get the horse and slip on some black ice and hurt yourself. Secure the perimeter. If you've got another gate that goes out to the road, you have to get to that one first. Because often, we have these properties with multiple gates, and if you can at least close off the outside ones, at least you've got them contained into an area where you can hopefully round them up. And then when you're finding and catching your horses, and if you don't have a horse accounted for, I think you should probably call the police or something. probably let them know. But yeah, while you're catching your horses, you can start assessing them before you've even walked up to them. And maybe they're going to be fired up and they're going to be trotting around and it takes you a while to catch them or something, right, if they're excited. But you can start already as you're walking towards them. You're sort of slowly walking over. You can look at how they're moving. Are they limping? Do you see any injuries on them? What their mentation is? Are they excited? And you can be starting that process before you get anywhere near them. So basically, look at what's going on, keep looking at the situation and everything that's happening around you, especially if it's at a busy property where there might be people reopening gates to come in and out or something like that, you know. You kind of have to always be paying attention to that. And then finally, when you've rounded up your horses, so you're going to do your detailed examination. I mean, if you've got something that's actively bleeding or that's really emergent, obviously you will have called your veterinarian as well. But you can do your TPR and your health check, palpate limbs, look for any scrapes, cuts, abrasions, give them sort of a once-over. And then the final note that I did here, veterinary examination, you know, if there's only minor injuries, if everyone seems to be stable, then you might decide to monitor and call the vet the next day. Or if, you know, if there's something more emergent, then you'd call us and we'd come out that day. Basically, I just wanted to point out also that some injuries aren't going to be immediately apparent because when horses have been running around loose and they're really excited, they might not be showing a limp, whereas later on the next day you might see something. So you've got like adrenaline, tying up if they've been running around a lot, or colic. If one of your horses was a really fat pony that got into some lush grass, then you're going to be really watching for founder over the next few days. So when you have an emergency situation like this, you have to respond in an emergency fashion, but you also have to monitor them for the next few days and kind of follow up with it.